It's about people, not politics.
I'm hopeful Congress will get there, but it is frustrating that it is this painful.
The process unfold relative to H.R. 1 was quite different than anything I have seen up to this point.
I do think that's one of the best things we can do to sort of break down intractable nature of Congress.
Hi, I'm Pears Kelly. I'm the CEO of Advocates for Community Health, and this is Community Health Centers Unfiltered, where we cut through the noise and talk about what really matters: people, policy, and access to care. On today's episode, I'm joined by Jen Taylor. She's the Senior Director of Government Relations at Families USA, a leading national voice for healthcare consumers. Families USA is laser focused on ensuring every person in America, regardless of income, background, or zip code, can access the healthcare that they need. That mission makes them a powerful ally for community health centers and the patients we serve every day. We're going to dig into how federal policy is either helping or hindering access to care and what we can do about it. I couldn't be more excited to have this conversation, so let's get into it. Hi, everyone. I'm Pears Kelly. I'm the CEO of Advocates for Community Health, and I'm so excited to talk with Jen Taylor today. She is a dear friend and a former colleague, but she's doing incredible work at Families USA. Before we jump into questions, Jen, can you just introduce yourself, please?
Happy to. Hi, Amanda. It's so good to be with you. And for your listeners, I'm Jen Taylor. I'm the Senior Director of Government Relations here at Families USA. I'm sure we'll talk a little bit more about what we do here today, but I also, before I came here, was a long-time staff member at the National Association of Community Health Centers and a longtime community health center advocate. So I'm happy to be here in my current role and also reconnecting with my health center family, which means a whole lot to me. So really thrilled to be here and happy to talk.
Yeah. Ooh, I just got to chill because, health centers get in your blood and they never leave.
They do. It's very true.
So Jen and I had a boss who used to say, well, there are people who know health centers and then or who don't know health centers, and then there are the people who love health centers. And I think it's very accurate because it really does get in your blood. But I want to talk about families and what you do there. And I know a lot of the work that defines the mission at Families is around access to care and your lens to advocacy, all of that. So can you maybe start there? Let's talk about what Families does, what you do there, kind of where the lens and the mission is.
Happy to. So Families USA is a consumer advocacy organization. We've been around for about 45 years now, and really see ourselves as the consumer voice in policy discussions, both here in DC and in states across the country. Often consumers, patients, the people at the center of the care are the ones who are left out of the conversation. And so our role here is to make sure that that never happens. Our mission is really very aligned with the mission of health centers. We want to see comprehensive, high quality, affordable access to care for everyone. So it's not complicated, and yet somehow it's the most complicated thing we could work on. But, we are here and again, much like health centers, access to care is just a huge focus for us. We want to make sure that people have health insurance so that their care is affordable, whether that's public or private or whatever it is that they're qualified for, that they are getting that coverage. And then once they have that coverage, that they have a place to use it, that they have a provider who will accept that coverage, that they can get, again, high quality care in their language of origin, meeting their needs, that is empathetic and respectful and, patient-centered. Again, things that I think we all have very similar goals on, but continue to be pretty out of reach in this country. And the way that we look at health is certainly the care provided, in a provider setting, at home, whatever it may be, but also just your overarching health, what you carry with you every day, the access you have to affordable housing, education, food, transportation, the things that we all need to live and be well. And that's also financial stability, which is a huge component of health. If you're able to access healthcare, but you can't afford then to put food on the table, then that's not your healthiest existence. So we look at the role of health and healthcare really holistically. And it's, again, I think a really nice complement to exactly what health centers do. And we're proud to advocate for health center patients as part of our work as well.
Yeah, well, I was going to say, there's a nice line between where you started and where you are now and what you took with you, and we just adore you. I adore you. But I'd love to talk a little bit about the policy components there, and specifically and I will also preface this by saying there are challenges, there are roadblocks that I think we need to talk about and identify in terms of what that looks like from a policy perspective for patients to access that care, particularly in underserved communities, but then also some of the things that do exist, like health centers and or opportunities. So you want to sink your teeth into that one?
I'll start, and you tell me where we keep going with it, because that's obviously there's a lot we can talk about there. I mean, I think when we're looking at the work that we're doing here at Families USA, almost always one of the biggest challenges is just just affordability. We live in a country that spends extraordinary amounts of money on healthcare that theoretically should be the quote unquote best health system in the world. Certainly we have the technology, certainly we have extraordinary providers, but when that care is not affordable, none of that really matters, because that it exists, but you can't access it, you can't afford it, your family isn't going to benefit from it, means that we're both spending all of this money and we're still really unhealthy. And in fact, lots of indicators of health have gone down over years when you're talking about, maternal mortality, even lifespan. I mean, we're talking about some fundamental crude measures of health that have gone down despite all this money we're spending. And so I think that what's frustrating to me in terms of starting with the challenges is there's any number of places within our healthcare system that we could make policy improvements. And again, happy to get into any of them, but sort of top line, I think making the system more affordable in terms of thinking about how we pay for care, what we're paying for. If you're paying for volumes of sort of low quality care, or if you're paying because you're getting good patient outcomes, ways that the system is really fragmented and ways we could be incentivizing a whole person care approach. There's a number of things we can do to bring down pricing, providers in terms of, run the spectrum. And I think health centers are really the model of how you can have a sliding scale and figure out how to meet people where they are. But for most of the system, you don't even know what something costs when you go to get it. You can't even get a price. You can go get a price before you get work done on your car. You can't get price done when you're going to access care. And so not only do they not know if they can afford it, they don't even know where they're starting from. And then they're charged all different things. And so we have this real crisis of fundamentally how the system is set. And yet when policymakers are going in to make changes and to make cuts to the excess spending, it's coming out of all the wrong places. So as we just saw in HR 1, where we didn't go in and figure out how to fundamentally improve the system. They didn't fund health centers, in the long term or in the short term. They cut $1 trillion out of our healthcare system, largely out of Medicaid. And that isn't going to get us there. So I think there are big challenges in having people really focus that, yes, there are changes to be made, but they shouldn't be made on the backs of people who are just trying to afford their healthcare. They're focused in the wrong directions. And I think, advocates having a really loud voice right now to talk about exactly what they do want and they do need is more important than ever. And I think to that end, there are opportunities. I think a couple of things that we're working on, definitely trying to continue to mitigate harm and the fallout from HR 1 when it comes to Medicaid. Regardless of how you feel about a work requirement, which Families USA did not support including, but it exists now and we've got states that have to implement them. And we want to make sure that they're doing that in a way that minimizes, any unintentional damage. That means that there are people who are still very much eligible for coverage who fall off because of paperwork burdens and not sure what to do in the system, states who have to plug budget holes. And so we're here trying to figure out what are proactive solutions to help support states and help support providers in that environment. We're also working on extending advanced premium tax credits. I'm like the A for affordable. That is the number one word I'm using. But in this case, premium tax credits, which make healthcare affordable for folks who are often, entrepreneurs, small business owners, in the gig economy. They're doing rideshare, they're doing, food delivery, they're a plumber, any number of things that they are working but can't afford an insurance plan. And this premium tax credit helps them get one. And there's an opportunity right now in Congress with bipartisan members talking about it, just as there is with health center funding, to make an extension as they're looking at extending funding for other programs. So that's the kind of stuff we're focusing on. It is both, again, trying to minimize damage from something that I think is really challenging and has created a really tumultuous coverage environment and a lot of questions and concerns for state advocates, for health center patients, for people across the country, and still looking for opportunities where we can get direct relief in terms of affordability right now. And then hopefully be building to a system where we're talking about the ways we could be really proactive and reinvesting in the parts of the system that are working, supporting our workforce, doing these things that we know work, but they're just not in the conversation right now because we've been focused, not we, I would say Congress and this administration, in my opinion, and in Families USA's opinion, has just not been focused on the right things.
Okay, so there's
a lot there.
Yeah, I was just gonna say, you said so many things that I'm like, okay, let me pull some things out, and then I want to kind of stick a pin in the tax credits. But I think, so from kind of like, all right, let me put the House under lens on this a little bit, and things that like I don't think people realize. One, I think there's this misnomer, as you know, from working with us and or with health centers for so long, is that care at a health center is free. It's no, it's not. That sliding fee is whether you're paying $1 or you're paying $100. The whole point is that you're accessing care no matter what situation you're in, regardless of your ability to pay. But the way that you're accessing that care also takes into account your ability to pay. That's a whole part of the model. And it's really important just in the context of, I think, some of the misnomers about like, oh, people aren't contributing or people are accessing care and it's just free for everyone. No, it's not. I think the other thing that came up in what you said that's so important is that the cost of care and rate setting, like I think that's the other thing that people don't realize about health centers, right? With our PPS rate, it's, as the cost of everything in our economy and our reality is going up, health centers are subject to that rate regardless. They can work with their state to adjust it. But for the most part, that's a static rate. Now that's helpful, as you know, just from a solvency perspective, but it's not like other providers where they have some flexibility in terms of how they adjust to be able to cover their costs even. But then the other thing is that, and in terms of where we are, the administration and where there are opportunities, I do think that Make America Healthy Again actually really does lend an opportunity in terms of especially where health centers can serve as a foundation to that, because hopefully the emphasis is now turning to keeping people healthy, preventing them from getting sick, leaning into primary care. And you know as well as I do, health centers are the largest primary care network in the country. So I think, to me, that's one of the biggest and the best bright spots and opportunities right now. If I think about, okay, how are we transforming as a healthcare system and where are we going? Make America Healthy Again does appear to be seeking things like chronic disease management and whole person health and nutrition and food as medicine. These are all things, as you know, that health centers have been doing for decades and doing quite well, and the data is there to back it up. My hope is that as we see greater clarity around what that is actually going to mean, and that there will be resources behind it. Because to your point, like we're not in an easy situation right now as a program in terms of what is happening with our funding. It's a tough environment. Obviously, we're looking at how do we dial back, or not we, Congress is looking at how do we dial back, how do we rein in spending, which is fine. That's where we are right now. But I think something you said is sort of like, where are we putting the investment? Where are we putting the resources? And I think, to your point, making sure that patients have access to care. And something else that you said that I think aligns very much with this moment, which is like giving people more information to what it actually looks like, the cost of things, like healthcare. I will say, I'll call this out too. It's not exactly like, going to get your car fixed where you might shop around for like, let me find the greatest deal to replace my carburetor. It's not that. With healthcare, you're obviously looking for the best person and the best outcome. And sometimes the cost of that can be prohibitive. But I don't think, I think sometimes the correlation between like, consumers need to be able to shop for their healthcare. And it's like, well, if they had the resources, they're going to choose the very top of the line because that's the point. So it's not exactly an apples to apples conversation, but let's bring it back to the tax credits piece of this because it's such an important part of what's going on. But I think a lot of people don't necessarily know even what it is and sort of what this moment in time is, how it impacts them, why it's important, how it ties into the bigger picture. So can you unpack that and give us a 101?
I'll try. So the premium tax credits actually, and I do think there's a lot of misinformation about these. The premium tax credits originally were authorized under the Affordable Care Act. So going all the way back to 2010. This was the way, as there was bringing in, that everyone was going to have a requirement to have insurance, which over time has changed in terms of enforcement there. But to help people then pay for that insurance, there was an investment in premium tax credits. It's been, I would say it's funny to hear things sometimes later be talked about in terms of, what a radical approach this is or isn't to healthcare. I would say it's a pretty modest, actually, approach to healthcare, which is helping people get a tax credit so that they can purchase insurance in the individual or, private market. So these are people that are using their own dollars to purchase insurance. But as you were just talking about the rising cost of everything, premiums have been slowly and steadily going up for years, despite the fact that there's been many, many successes in terms of coverage rates have gone up, the uninsured rate has dropped. I think we are in this moment where this is going to be a challenging time to see if we're able to maintain that with all of the changes that are happening. But these premium tax rates have been a huge success story in helping people get coverage because they can see what it's going to cost them and they can make a decision for themselves. If they're a small business, maybe they've got 3 employees that are going in there. They're often people who are in caretaking responsibilities. These are people that really just need some assistance in purchasing insurance. And so what we do is in the form of a tax credit. In the pandemic era, when it was, even more challenging on people's budgets, and particularly for folks who were in the gig economy, who were delivering food, who were artists or entertainers, who had small businesses. It was a really difficult time, obviously, for everyone, but certainly for them to maintain a living in the middle of a pandemic. There was no work from home option for folks. This is not work could be done via Zoom. And so Congress really made the decision to invest in bolstering those premium tax credits, to just say, they're a little bit more generous and they go a little bit further up the income scale, which honestly just helps smooth out and keep people able to keep purchasing their insurance. Now, over time, costs have continued to go up. We're seeing this year premium rate hikes. I think right now the average between what's been proposed and some states what's been finalized in these markets is about a 23% rate increase.
Wow.
And this is after years of single-digit increases that have already been challenging for folks. In a year where you're seeing average of 23% rate increase, this means people would have to drop coverage entirely or shut their business down, or this is really an existential crisis for folks who purchase their own insurance in the marketplaces. And so that's why it's so important that they be extended. As most things are in federal laws, we're very familiar with on health center funding. When these kinds of investments were made, they often put a sunset on them, some sort of expiration date. So Congress has long known we were approaching the expiration date here at the end of December 2025. As again, I think health center funding, unfortunately, we're all too familiar with. Congress is often doing things at the very last minute. Yeah. 11th and 3/4 hour, if not beyond. And obviously there's a lot on their plate, but what that doesn't take into account is the real world impact of planning. And so in this case, we can talk a lot about health and centers needing to be able to plan, budget, look ahead as businesses. In this case, insurers are anticipating that if there is no relief here, they're going to lose. Maybe at this point, the estimate is about 4 million people would come off of insurance altogether out of the 22 million who are purchasing insurance in the marketplaces. And that means they're going to have sicker risk pools. It means, they're anticipating a loss of a lot of business and they're hiking up premiums in anticipation of that happening. And so we're already seeing the effects. And now Congress really, really needs to act. And again, it happens to be on a similar timeline with health center funding because it is set for the end of this year. We know health center funding goes through September 30th at this point in terms of the part of the grant. But when there's very limited opportunities in Congress to get things done, they all kind of come together on one big collision course, usually with funding legislation. So as we're approaching the, fiscal year end and the next appropriations, continuing resolution, however they decide to extend funding for the government, we're going to be advocating both for the premium tax credits for working families, many of whom are health center patients, and for the larger funding for health centers itself. So we're kind of they're different, but there's a lot of actual similarities, and there's a lot of overlap, I would say, in the people who use health center services and the people who are purchasing their own plans using a premium tax credit.
Well, I think it's all, yeah. I mean, I think
they're also getting this double whammy.
Right.
So we really need to lean in and helping.
Well, I think that's the thing, right? It's all connected. And again, like if I'm going to pull a few things out, it's like, okay, so to your point, there are the way that sometimes these programs work, or when something is launched, it's with a sunset, with the intention of like, we're going to roll this back down. It's going to, come to a close. But I think the reality is, and for as long as I've been working in health policy, and you too, there's no need to do that when the policy actually works. And I think that's the thing with this one. It's sort of like, okay, well, we're talking about, do you keep someone in coverage, enable them to stay with coverage? And again, to your point, like they are contributing to that this is not like entirely subsidized by the government or the state. So basically keeping them in coverage or putting them back in a situation where they're uninsured and they're probably going to become more ill, and or the way that they then access care is not in the kind of setting where it's a continuous integrated care model where, maybe it's an emergency room. That's the most expensive form of care. So again, when I just to sort of bring up, it's like, well, this is actually a policy that's working. And you said, ooh, your light turned out.
My light turned out. I'm so sorry.
That's okay.
Keep going. We're going to roll.
Well, the other thing that you said that I really want to lean into, because I think it's the same thing with health centers, is that there's bipartisan support. So what is that? Talk through that a little bit too, because I think for families, as is the case, we are completely nonpartisan. Like we work with everyone. We have this incredible history of bipartisan support. And that's been such an important part of how we've been able to be successful as it relates to policies and funding and resources, you name it. But this one too. So I'd love to hear it is bipartisan. So where's the holdup, I guess, is the piece, right?
I know. I was going to say, I think we're just very familiar with the fact of, and how frustrating that can be. And I get it. Policymaking is challenging. There's a lot of other factors outside of just the value assessment on the premium tax credits or the value assessment on what it is to fund health centers. But it's really frustrating to be such an obvious solution and still be stuck in limbo like this. And I think increasingly, it's no secret that it's a polarized political environment. I think that has certainly not gotten easier through the last 6 months of HR 1 and some of the big changes that are happening. What my hope is that people from across the political spectrum can at least look at these issues for what they are. They are not sort of leverage points. This one is good for me and that one is good for you. Premium tax credits to help people purchase their insurance, funding for community health centers. These are things that benefit people of every stretch of the imagination in terms of political ideology, community perspectives. And I think what makes them so bipartisan is that there's really good return on that investment. We see the proven value of what they do, how people have benefited. And, I think that they're really stuck in a political environment that's just really hard to move things through. So I am hopeful when we do see these glimmers of folks talking about, they're hearing from their constituents. They know this is important. I know, one of the things I'm hoping we'll talk about today is how we are really centering patients and consumers and those voices in these conversations, because they're undeniable. From a premium tax credit perspective, I was at a briefing yesterday where there was 3 women from across the country who were all small business owners, and they were just telling their story. And it was a room of Republican and Democratic staffers alike. And I've heard, the policy story of the premium tax credits many, many times, but just sitting in that room and listening to people who didn't have a political agenda. They weren't, I don't even know what their perspective is on any number of issues, but I know they sat there and said, for 3 different people, their choices were going to be, one woman was going to have to just close up shop because she was not going to be able to pay for her insurance. And she had, some underlying conditions that make dropping coverage not an option for her. So she was like, I'm going to have to give up this dream, this like American dream of entrepreneurship that she was living, that we have long said, we want and support, because she couldn't do it. And somebody else who was, in her 50s and had some health issues, she was saying she was feeling relatively healthy right now. And if that happens, she's going to have to drop coverage and take the gamble. And these are not the choices people should be making. And I think everybody in that room was struck that this is not the way to do policymaking, and these aren't the choices we should have to make. So I am really hopeful that, Democrats, Republicans, leadership on all sides, there's a lot happening in the world right now. There is a lot of contentiousness, but where there are places that they can come together and benefit their constituents, they need to find a way to get there. And I think two of these spaces are what we're talking about today. I think there are other things. I know we were talking a little bit about the systems change earlier, and come back and talk with you about that. I agree on shoppable services, but I also think there are some ways we can transform the system here. But there's some bipartisan support there. There was a bill that almost got across the finish line last year, and this Lower Cost, More Transparency Act that they could come back to and think about how we are really investing in a system that works better for everyone instead of just sort of lowest common denominator, hacking at something to save money and we'll figure it out later. I think there's a better way to do it. And I think these are some of the models for how you can move the system forward in the meantime and keep people in care as you figure that out. So I'm hopeful Congress will get there, but it is frustrating that it is this painful and that it is this slow to get there, to be honest.
Yeah. Well, it's challenging, but I think what you're kind of really pulling out is that it's about people, not politics. And I think it is a highly partisan time, and it has been for a while, good, bad, and different. That's just the reality on Capitol Hill. But I do still believe, and in all the years that we've been doing this, when you sit down and you really start to look at what does it look like from that perspective, it does change. I think we both have seen these light bulb moments, whether it's somebody visiting a health center for the first time and being like, oh, I get it now.
Yep.
I'm seeing when we talk about, how the health centers are a part of the community and they are consumer majority boards and all of that. And then, but it's writing in a statute or it's in a white paper until you go and you see it and you're like, oh, not only is it the consumer majority board, so it's patients informing the direction of the organization, it's also employing the community. It's the people who live there who are actually driving the organization and providing that care and access and all the services and you name it. But again, I think it comes down to that. It's about people and not politics. But we do have to deal with the politics. So the other thing I was going to ask you, and it's great to hear that you had these three women who were able to sort of share their story. But so what does that look like? How are we, and this is my heart, this is my forever hat with grassroots, but how do we elevate patient voices right now in the context of policy? Because I think it is also a different time, and certainly through watching the process unfold relative to HR1 was quite different than anything I have seen up to this point. But from your perspective right now, how do we do that? How do we elevate patient voices, and why is it important? I think that's the other thing is I think sometimes the public or folks that are not sitting here in DC have this feeling of my voice doesn't really matter. What's the point? They're so detached from what this actually looks like, all the things. I don't need to tell you, I know you, but I'd love for you to speak to that in terms of what you actually see and how do we do it and why is it important?
Oh my gosh, I'm happy to talk about this all of the time. It is also where my heart is in this. I'm a registered lobbyist. I think I'm a nice person and fun to talk to, but nobody wants to hear from me on all of this. Members of Congress hear from some version of me all day, every day. What makes the difference is people coming and telling a story about what this looks like. And I think what's so interesting to me when you think about storytelling in healthcare is what's more personal than that? If we wanted to run through any number of issues, sitting right here, we could probably pull 5 stories off the top of our head of something that has happened with us or a family member or a friend. Certainly for health centers, there are providers who are also people with their own stories of what it is in their family, the patients that they see. We've got patient board members. I mean, it is so personal to everyone in every way, and everyone honestly has a story to tell. I think some people might think, oh, well, in the case of premiums, mine's only going to go up by $200. I'll find a way. I'll just cut back on something. That's not a compelling story. And I'm like, well, cutting back on some of your food budget is a problem. It doesn't mean you have to go bankrupt to tell that story. I want them to hear, every version of this story. It is people who their kid is no longer going to be able to play soccer because the family budget is not going to hold it. Yep. And people who are literally going to have to make the choice between closing their shop or giving up their, health coverage. Both of those are stories that people need to understand the breadth of what the impact is. And I honestly think that people I want them to have more confidence. Nobody knows your story like you. Nobody can tell it like you. If you are, using a health center services, and they have some of the best bipartisan support of any topic, we could bring up. But still, members don't always know what that means in real life. Some of them go to a health center, either visit one or as a patient. But some of them just really don't get it until you can have a person in front of you describing what that means, and you can sort of sit with it and live with it a little bit. It makes all the difference in the world. You can have all the best data. You can make the most intellectually compelling argument you can possibly think of. And from my perspective, nothing really turns that light on like someone just telling their story. And again, I want people to have an understanding that every story on this matters, truly, because there's a lot to tell. There's a lot to work on. We have a really large story bank here at Families USA. It's also what you do with those. We don't want to just be collecting people's stories. We want to be making sure that we're getting them out there to the places they need to be. Not everyone can get on a plane and come to DC, nor do you want to. I get it. But, telling that story from where you are in ways that work for you, I think that it's something that we should all feel really confident participating in. And I think the more we do that, it just becomes an undeniable force that, people are demanding change. Policymakers work for the people. That is literally what they are supposed to be doing. They should be hearing from the people who are impacted by the decisions they're making. And honestly, they really want to. Yeah. Even with all my cynicism about Congress these days, and I have more than I used to, but we're working on that. They really want to hear from people. It helps them. It helps them understand the issue differently. They can ask questions and think about it and bring it back with their colleagues. They talk about it. They go to the floor and tell the story they heard in their office. You can hear it when they're out on the road in their districts, and they'll harken back to somebody that talked to them 3 years ago because it sticks. Nothing sticks like telling your story. So I am hopeful that in this time when it feels like, why does it matter? And it's hard to break through, I have empathy for where people are coming from. And I would say that's actually why we have to double down on being loud, being very clear about what these decisions look like in real life. That's not political. That's just the reality. Go tell your reality. Go tell your story. And I do think that's one of the best things we can do to sort of break down some of the partisanship and some of the intractable nature of Congress and trying to move on some of these really important pieces of legislation.
Yeah, everything you just said, yes, totally agree. I think the other things that I would call out, right, is to your point, like, you don't have to come to DC. You can, one, there's events going on in your area. You could live in a place where it might take some travel or some doing to get to it, but there's virtual opportunities. There's things happening at home. There's district staff. There's state-based staff. Every single person that's involved with that congressional office or that Senate office has the opportunity to share that story. But I also think it requires persistence. It's not a one and done. It's not something where you can just, I checked the box and, now I've done my part and now I've done. You have to care enough to really stay with it. But I also really appreciate what you said about the reality is if they don't hear from you, if they don't hear from home, they're going to just go off the best information that they have access to. And sometimes that looks like lobbyists in DC, and sometimes that looks like data from whoever sent it to them or whoever got to their staff member. So the reality is the public does have a choice. I'm not saying it's easy. I'm not diminishing the amount of energy and time and resources sometimes even. But I think there has to be some responsibility and willingness to say, this is really important to me. And then I think the education piece, right? Like I was at NASHB earlier this week, and we were talking about some of the changes that are coming with HR 1 and the importance of having the consumer voice, the patient voice, at the table as some of these things are being thought through and rolled out and policies designed. But the other thing is, it's okay for you not to know what all these policies mean. I mean, you and I look at it every single day, and I am still learning every single day. And so I also think along with that persistence and that commitment has to come some willingness to learn and to sort of seek out the education to be able to even understand what the impact looks like. Now, to be fair, and I think about some of our health center patients, do you have the time to like read up on health policy every day? No, you don't.
Totally.
I get it. That's not going to happen. But what I can say is once something happens and you see the impact for yourself, that's your opportunity to share the reality of what that looks like. And so, yes, if you can do the education, you can do the learning beforehand, fantastic. But even if you can't, I think it is just making the commitment to say, okay, this is what it looks like for me. This is how it rolled out. This is what the impact looked like for me. And then telling that story, to your point.
And that's the part nobody else can do, because listen, we can bring in good researchers. We have organizations like mine, associations like yours that can, crunch some numbers and really bring out policy. And that's really, really valuable. But there are people who can do that. So you can partner with those people. What we cannot do is tell your story unless we know your story. Really nobody can do that but you. And as we were talking about being at the table, I mean, it's back to the saying of if you're not at the table, you are on the menu. And I do think, to your point, there are all kinds of interests and lobbyists and private equity financing and all kinds of things that are flooding, airwaves, halls of Congress, making their case. And so if real people are not there, they will be drowned out by all that other noise. And I think health centers are a perfect example of what it means to center a patient. We here at Families USA, putting this consumer voice at the center of everything we do, I think it is our responsibility then to make sure that those voices are included also, that people can hear the full picture and what it is, because those are representing the thousands and thousands and millions of people who can't. To your point, you're working 2 jobs, you've got childcare issues, you are managing any number of things in your life. I don't think that every person by any means should have to become extremely educated on every policy in and out. I am just hopeful that more and more feel like they have a platform to tell their story. And that's, again, we're here to help with that too. So if people are listening and want to get more involved in that, I do think that I know both, health center advocates and certainly us at Families USA, we can help find a platform for you to tell it. We just need people who are willing to come forward and share it. And that's a huge ask. That's a huge ask of somebody. And I appreciate that. And I hold that with respect and gratitude for those who are willing to be vulnerable and share it. I just want to tell them that it really does make a difference. It is worth it.
Yeah, it matters. Okay, so I want to, in the time that we have left, I want to sort of not switch the health center lens, because I feel like we've been with the health center lens, but I do want to, I want to ask you, what gives you hope in terms of building a more accessible, equitable healthcare system, and maybe through the lens of health centers? So like, what does that really look like? But I mean, in this moment where there are 17 fires going on any given day, and we have to figure out, okay, we can't do all the 17 fires, but we're going to choose a few. But more important, what gives you hope? What keeps you going every day?
Such a good question, and particularly these days. I think a couple of things. Actually, I know I was saying we would bring health centers back into it. As you said, they never left it because they think they get in your blood and they stay there. And I do think health centers are part of the answer for me in terms of the people that I have met in advocating with and for health centers, the patients who go, the people who work there, the people on health center boards. Honestly, it sounds cheesy, but that is what gives me hope. I watch people who are just dedicating their lives to trying to make a better opportunity for the people around them and to come behind them. And I think that really inspires me. It does inspire me every time when I hear a storyteller. The reason I was thinking of those 3 women who own small businesses, each of them had a far more interesting and colorful story than I'd be able to paint here today. And I left just really, again, I've heard the numbers a million times. I left with a different sort of pep in my step walking out of that room, because I reminded me what we're trying to do here and who we're fighting for. So that does give me hope. I think the resiliency, honestly, of the advocates I've met, I'm struck thinking about a dear health center friend who many of you know, and certainly you know Amanda Souvier, who just passed away a few weeks ago. And I've been thinking about her a lot in these last weeks. And, she's one of the most resilient people I've ever met. I think she lived like 14 lifetimes. And while I wish she had more time, I'm so grateful that she shared so much of her sort of heart and soul and the work that she did. And as I've been thinking about her, the losses she, experienced personally, the work she did to become, a health center leader and really a national leader on issues like 340B. And I'm really inspired by the resiliency of our advocates who have seen how hard it can be and have chosen against all odds and figured out how to sort of like hold on to that and channel it into positive action for others. It keeps me going, even when I'm feeling like, what are we all doing here? That reminds me, that's what we're doing here. That's what we're doing here. And it's hard right now. It is a difficult environment in a lot of ways. And I think just the like sort of division that has been sown in many, many ways can make it feel very daunting. And I don't know what comes next exactly looks like. And that's a hard thing too. I want to be able to like see around every corner and paint you the exact vision of where we're going. I don't know. I don't think any of us do, but I do feel hopeful that all of these extraordinary people willing to come to the table and fight for their neighbors and their friends and their colleagues, that we will figure it out. And I think it's a really important thing to hold on to right now.
Yeah. Thank you for bringing up Sue in particular. I agree with you. That's a tough loss for many of us in the health center community, but also even folks that didn't know her. I mean, I think her advocacy and her voice literally saved lives and created access for millions and millions of people. But you're right. I think it was her resilience. I think it was her continued commitment to a North Star. And the North Star was doing more and doing better for the people who needed it, for her community, for health centers. And I think to your point, like none of us know what happens next, but I do think from a vision perspective, that's the North Star, right? It's to see not just adequate funding, but significant increased investment in health centers and support for the programs that help health centers to do what they do. And I think even in this environment where there's a lot of challenges and we're in the midst of a storm, I try to think of it as every single day, one foot in front of the other, and just get through that day. Just do what you can to keep moving forward in that day. And day by day, you're going to get closer and closer to that North Star, to that vision.
Well, if you look at the health center movement, that's what it's been since the beginning, right? So before there were health centers, the reason they came to be, the tremendous challenges in this country that people did not have a place to go. We're dealing with, deep-seated racism in the South, the way that things had to be created and mapped just for the health center to start existing and what they've overcome, how far they've come to 30 million patients to be in the position where we're talking about fighting for these dollars because the program has proven to be so successful. That should be the reminder for all of us. Like the resiliency of the advocates who came before got us to this place, and it is our job to pick it up and figure out how to get to the next one. And I do believe we will, and I'm glad to be in the fight with all of you. And I know we'll have lots more to talk about in the years ahead, but I appreciated the opportunity to come in and talk with you about it today.
Well, you are a true advocate. You are a shining star for all of us. We're so grateful to have you on to have this conversation, but also for all of the work that you're doing. And you're right, this is just the first of many conversations to come, but thank you so much, Jen, honestly.
Maybe I'll be able to keep my office light on in the next one. I'll come in studio for a future one, and we won't have to worry about that.
Yes, 100%.
But just like health centers, you just roll with it, you problem solve, you keep going, so.
Sounds good.
I appreciate you, Amanda.
We love you. Thank you so much.
Be well.
Bye. Jen, thank you so much for being passionate about advocacy and patient access. Your work reminds us that policy isn't just paperwork, it's people's lives. It's their health and their dignity. To our listeners, if you care about ensuring everyone in America can get the care they need, no matter who they are or where they live, check out Families USA and join the movement. Thanks for listening to Community Health Centers Unfiltered. Make sure you subscribe, share, and stay tuned for more real talk on health policy and the communities it impacts, and specifically health centers, of course, always. Until next time, keep advocating, keep pushing, and keep caring. See you next time.